Every year, thousands of infants are injured or die due to unsafe sleep. I am proud to announce that Cribs for Kids is celebrating its 25th year anniversary of helping every baby sleep safer. In 1998, we discovered in Pittsburgh that 90% of the babies who continued to die were found in unsafe sleeping environments. We decided at that time that if we provided cribs and safe sleep education to parents, we could change the culture and save babies' lives. By 2004, we had about 32 organizations around the country who were asking us to implement the Cribs for Kids program in their communities because they had seen that our rates had dropped so drastically during those years. That's when we decided that we would be a national nonprofit organization. At the beginning, we were using the Graco Pack and Play as our safe sleeping environment, and because we wanted a unit that had the safe sleep message on it, we got a manufacturer and we started to manufacture our own crib. We call that crib the Cribette, and it's not only a safe sleeping environment, but it's an educational tool for the parents. It has the ABC, Alone on My Back, logo embossed on the fabric, so it's a constant reminder to the caregiver that the baby should sleep alone on its back in the crib. We expanded then to produce wearable blankets and swaddles and other safe sleep materials, and through the sales of all of these products to our partners at discounted pricing, we were able to expand our organization. Cribs for Kids now has over 1,800 partners nationwide doing our program and purchasing our discounted products. We have several free programs we offer to our partners. They include the Hospital Certification Program, in which we certify hospitals and hospital systems for teaching safe sleep. The Managed Care Organization Program, in which we provide incentives to patients who perform all of their prenatal and postnatal visits. Our National Public Safety Initiative provides education and free cribs to first responders who are our eyes and ears in the community. The Safe Sleep Ambassador Program is a free online educational program that caregivers, daycare providers, or safe sleep advocates can become certified in infant safe sleep and receive a certificate. To date, we have distributed over 900,000 cribs nationwide. Our goal is to reach 1 million cribs distributed throughout 2023. You can help to change the culture surrounding infant safe sleep. Whether you're a community organization, a hospital, first responder, or managed care organization, or an advocate who cares about the safety of infants, we ask you to go to cribsforkids.org and join us in our mission to help every baby sleep safer.
Cribs for Kids debut of our 25th anniversary Safe Sleep Champions webinar series. I'm no Kate McKinnon of Saturday Night Live, so you're going to see some things as we try and get this started live for the first time. So we appreciate your patience and with that. So I hope you enjoyed the video that started the meeting. If you missed any of it or all of it, don't worry. You'll find it on our website. We have a webpage dedicated to our 25th anniversary, and we'll put that link in the chat here in a second. And if you're watching the live recorded version of this, you'll be able to link to that video as well. So, hey, my name is Devin George. I am the Chief Program Officer here at Cribs for Kids. I will be the host, unless I really tank this one, and maybe we're on that path, for many of the monthly webinars across 2023. Today is the first of these. They are our free monthly webinars inviting safe sleep champions from around the country to share the work that they do to change the culture around infant safe sleep to prevent the thousands of infant deaths and injuries each year associated with unsafe sleep. Some of these webinars will be really interactive. Some will have panels, some will have Q&A, some will be 30 minutes like today, some will be an hour. The thing that's the same is they're all free, and they'll all be recorded and available on our website. So for our first one, we're keeping it simple with a conversation with Safe Sleep champion, Dr. Mike Goodstein. And as you'll see, Dr. Goodstein is a champion among champions. So you'll also see that your mic and camera are off, but if you have questions, you are welcome to put them in the chat. And if we have time, we'll do our best to get to them. Then before we get started, a little teaser to stay with us until the end of this webinar for the debut of our newest effort to change the culture around safe sleep. It's really something to sing about. And for those of you joining us live, you'll be the first to hear it. So let's get to it. For our very first Safe Sleep Champion webinar, we welcome Dr. Mike Goodstein. Dr. Goodstein has been a board-certified neonatologist for almost 30 years. He's the Director of Newborn Services for the WellSpan Health System and an adjunct professor of pediatrics at the College of Medicine of the Pennsylvania State University. Dr. Goodstein also established the York County Cribs for Kids program and has been its director since 2003, which sounds like that's recent, but that's 20 years ago. He is a Cribs for Kids board member and serves as the conference chairperson for our biennial National Infant Safe Sleep Conference. You might recognize his name given his leadership with the American Academy of Pediatrics Task Force on SIDS, of which he's been a member since 2010. And you might recognize his face because you saw him all over CNN and national news networks with the AAP 2022 AAP recommendations. So let's get to it. Welcome, Dr. Goodstein. How are you today?
I am good, Devin. It's so good to see you. And please don't be formal with me. We are friends. Call me Mike.
All right.
And it's really an honor to participate in the kickoff of this exciting year of the 25th anniversary of this wonderful program of Cribs for Kids. So thank you.
Sure. You know, we needed you in your corner. I'm sure everybody heard Dr. Goodstein go, Devin, they can hear you. So it's the beauty of live. So thank you for that. So, okay, a neonatologist. You've become it. How does a neonatologist become an expert in infant safe sleep? We know you've worked with NICHQ and NAPPSS-IIN, and you sit on the Safe Sleep Task Force, and you do more. So can you tell us how a neonatologist gets interested in infant safe sleep?
Yeah, sure. I mean, actually, you would think it would be kind of inherent, but back in the day, they really didn't teach much about safe sleep or SIDS. It was kind of a black box. We're still learning all the time with the research. But I was just kind of doing my thing as a neonatologist. And then there was, as Judy will say, there was one of those hand of God moments. And that happened. So it's Judy and my chairperson, Dr. David Turkowitz, really turned the course of my career in another direction. Judy came out to give a grand rounds. Cribs for Kids had just become put together as a program in Pittsburgh, and she was invited to do a grand rounds. I was post-call, I had a bad night on call, I was very tired, and I was looking at the list and it said Cribs for Kids, and I thought, well, everybody has a crib, that sounds kind of silly, I don't know if we'll go to this. And then there was this thing called Jewish guilt. I hear my mom's voice in the back of my head saying, Michael, go learn things. You shouldn't cut out just because you're tired. You're supposed to be getting educated. So I went to grand rounds, and Judy gave this fantastic talk and opened my eyes to my ignorance about not understanding that many people didn't have a safe place for their baby to sleep, and that created dangerous situations and increased their risk of dying of SIDS. At the end of this great presentation, our department chair, Dr. Turkos, gets up and says, they can do it in Pittsburgh. We can do this in York. I want to replicate this program. Who will be willing to help? And I thought, you know what? This is something that if this can help babies live, then I want to be a part of this. So I raised my hand and said, I'll help. A couple of weeks go by and I didn't hear anything from Dr. Turkowitz. So made a mistake, called him and said, hey, what's going on with this program? I want to help. And he says, well, I got all these things going on and you sound interested. Can you run it? And I was like, I kind of got a full-time job already, but I don't know how to write grants. I really don't know how to do this stuff. But if you guys help me and teach me, I'll try it. And so we got a group of people together, and with a lot of guidance from people who were a lot smarter than me, we started putting together a program to do this in York. And Judy sent me information on how to write a grant, and we got a $3,000 grant from the Young Women's Association, and we worked with our coroner's office, and we started in 2002, 2003, and we're heading into our 20th anniversary, and things have just grown a lot from there. But without going to Judy's lecture and having the support of my department chair, I wouldn't be doing this work.
And your mother on your voice in your ear. As a mother of boys, I hope that someday my boys hear something in the back of their head that get them started on something fabulous like what you've done. So having you on our team here at Cribs for Kids, both as our board, on our board and as our medical advisor and working on the conferences, how did you find yourself working directly with Cribs for Kids?
Well, again, I'm indebted to people, my partners really. So you have the national conference every other year, and I think it might have been the second conference. This was before I was in, got an interest in this, and I saw the conference, and I told my partners like, yeah, this is like gonna be really cool, but it's when I'm working, I can't go. And they said, well, no, you're going because we want you to bring this information back because we want to do better in our community. And they switched my schedule around, so I got out there. And I got to this really incredible conference, not knowing anybody. And even though I looked like an extrovert in a crowd of people where I don't know people, I'm actually pretty introverted. So I'm indebted to Judy and to one of our past people who was really instrumental in SIDS of PA and Cribs for Kids, Eileen Carlins, who we miss dearly, but she just grabbed me and started pulling me around and introducing me to people and showing me stuff, and was very encouraging and brought me into the inner sanctum of Cribs. And then Judy also did the same. And then Dr. Tyrella, who also is a member of the Cribs, she was giving a lecture and she just grabbed me and said, come up on stage. I want you to talk about your program. So just like sight unseen, I was just thrown into, immersed in all of this. But that's how it kind of started. And then I think there are other things we're going to talk about we started developing our own program. And the reason we were able to do this is because the conference is such a wonderful conference in that everybody shares. It's different than your typical research conference where everybody is proprietary until their stuff gets published. And so it was such an exciting conference. I learned so much. I took all this information back. I said, let's take all these great ideas and put them together. And we put together our safe sleep program. And I thought, well, we need to kind of study this. So we started putting things together. And I see Dr. Krugman's on the call today. And so we started talking because I think Judy might have put us together because he was doing similar work. And then we were able to put our stuff together and work towards a research to show what we were doing and that this could be successful and replicable in terms of improving outcomes in terms of safe sleep.
Yeah, I love that conference as well. That, my background as well, people really kept their information close to their vest. And I do love this, the conference that we have for safe sleep and the safe sleep community, because we're all like, hey, this is working, or hey, this didn't do anything for us, or here's a cool new piece of education that we have. And that's something, we'll share something like that at the end here. So I echo your yay. I also want to take a minute and echo your yay for Eileen Carlins. My colleague Andrea is here running the keyboard, and she worked very closely with Eileen, and she is nodding her head when you talk about how she really just pulled people in and welcomed them, and that's how she helped build this safe sleep family we have. So
before you go, I just have to say another word about Eileen. We would lecture together, and no matter how many times I heard the same lecture, I always learned something new from her. Her passion, it was just infectious, and she was just, I miss her dearly. I do.
Yeah, I am sorry that I missed the opportunity to work with her. I've only been with Cribs since 2019, which is now, coming up on 4 years. And that sounds like a long time just to me, given how quickly that's gone. So I can't imagine how these 25 years feels to Judy and the 20 years to you. And I'm so lucky to be here. And part of my work here, I work most closely with our National Infant Safe Sleep Hospital Certification Program. I am so proud of that program and the work that our hundreds and hundreds of safe sleep hospitals are doing across the country. And that program only exists because of Judy and you. So can you give us a little more history? I know you mentioned it, but as to how that program developed.
Yeah, again, it's always like you get to stand on the shoulders of giants to see into the future to do other good things. So again, there's always a debt to pay to other people who are involved with this, and the people who really sparked my interest in this was Bill Schmidt, who ran the Halo, sleep sack company, who had lost a daughter to SIDS. It was Haley, which is why I named it the program, his company Halo. And to North Carolina had a safe sleep. I believe a safe sleep group. It's defunct now, but I saw what Bill was doing, which was he was offering his product to hospitals for discounts or free based on promoting safe sleep at the hospitals. And I thought everybody should be doing this, right? Every hospital to promote safe sleep. How do we get the education to families? Well, this is one place where you get every parent, right? That you can get them while they're at the hospital. And Scott and I had done this work together, and we knew that there was a way to make this work. How do we get others to do it? Well, let's make a certification program. So I started looking at different models that were out there. There's hospital magnet programs, nursing magnet program. There's a baby friendly. A lot of these programs can go $10,000, $50,000, $100,000. Well, that's a huge barrier, right, to get people to do it. So I knew whatever we were going to do, it had to be either really cheap or free, because we didn't want a barrier to keep people from promoting safe sleep. And I reached out to Bill and I talked to them, and he was really willing to work with us to try to expand what he was doing, which was to get education out there. And I found a model with the North Carolina people. So I reached out to them, and they were very generous in sharing it. It was a beautiful program. I said, well, we want you to partner with us. You can take the lead. It's your program. And they said, we're struggling. We don't have the bandwidth to expand this, but we're going to give you permission to take this and run with it because we like our program and we want to share it. So again, it's I guess the phrase is steal shamelessly, but with permission. And we were able to kind of put this together, test it out, work with other people, and then we put it out there, and we started having symposia online to share with other people, and we worked with health departments and states, and it just grew and grew. And then you came along, and you've just kind of given it a booster shot up to a whole nother level. So the work you're doing has just been phenomenal, and it also means that I haven't had to do as much work with it. I've given it over to you, and it's really, I think it's been a great success, and you've just done a wonderful job making it grow and making it better. And that's the great thing, is that we learn new things, and it's organic, and you pull all these new pieces in, and we work together to make it better and better. We throw things out that don't work, and we add things in that will push it forward, which is fantastic.
Yeah, I just love the program, and talk about standing on the shoulders. I mean, I came in here and you guys had built that, and then I was lucky enough to be able to welcome a new colleague, Kaylee Fagundes, who some of you who work with us on the program here will know that name, and she has really taken it to the next level, right? I think she's taken it up to 11, as they say. And we do love that. Again, it brings in that whole idea of collaboration. So while we have set minimum requirements for hospitals to earn certification, and so often hospitals are already doing that work, and it's recognizing them for their work they're doing, or also providing them a way to grow their safe sleep practice. It's founded, as I want to be sure people who are on the call know, that the hospital certification program is based in two things. One, we know that families do at home what they see done in the hospital, so let's be sure those families see safe sleep in that hospital, which is, so important as a neonatologist as those babies transition to that home sleep environment, but also in the AAP recommendations. So having wrapped up, right? So you released those AAP recommendations in June of 2022. We got down to making sure that our hospital certification program was updated to reflect those changes and the expectations. We do give hospitals a good year to turn around and meet those. So having wrapped up that task force work from last year with the release of the 2022 AAP recommendations, I suspect you continue to raise your hand, and so you're probably working on other things for safe sleep. So what are some of those things that are forward looking?
Yeah, well, the task force, it's a 2-year process to get out that policy statement and technical report. I think there are almost 130 new articles that were reviewed for that. So we're always keeping up to date on the best information for the recommendations. But it's quite a process. So usually after it's done, we take a vacation and have a drink or two. But actually, there's a ton of work after it releases, because then we need to get the information out to the public. So there's a lot of, as you had mentioned earlier on, there's a lot of media opportunities to try to get information out there. We want to share it with healthcare providers, with public health officials, and then we work very closely with NICHQ and the Safe to Sleep program to make sure that they're ready to roll and promote that in a way that's demedicalized so people can understand it. So there's a huge amount of work with that. So that's kind of settled down. And now we have some time before we start working on the next iteration. So it's usually every 5 to 6 years it comes out. So in the meantime, we go about doing our research and other work to promote safe sleep. Continue to do a lot of lecturing. Now the NAPPSS grant is kind of transitioned over. It's kind of getting relabeled, and the American Academy of Pediatrics has now got that HRSA grant, and it's been reinvigorated as the National Collaborative for Safe Infant Sleep. So they asked me to be the medical director for that. So we've been working really hard to figure out what the goals are for this. It's kind of a short grant. It's only a 3-year cycle. And we're trying to figure out, a lot of the work has been, hospital-based, prenatal-based, large scope. And really what we need to do is kind of now comb this down. What works, then how do you get it into communities? Because that's where the rubber meets the road. And you need trusted people in the community to make your programs work and to also get the buy-in of trust. And so that's kind of the goal of this next cycle. How do we take that next step so that we really are getting community integration of safe sleep?
Yeah, so important, because we know, right, recent research is showing that people know the ABCs of safe sleep and are aware of those AAP recommendations. And it seems that most families have a safe, separate sleep space for baby, but it's a struggle to use it. Safe sleep is difficult. So how can we be sure that the community and families and anybody who's there for mama is supporting safe sleep? It's a challenge. It's a challenge for sure. So as part of that challenge, let's say you had a magic wand or a magic stethoscope, and you could wave that around and make 1 or 2 big changes to ensure that babies are sleeping safely. What would those be?
Well, I was hoping you'd let me use the magic wand to maybe like win the lottery or something, maybe do some early retirement.
I don't think that's what you do with the money. I'm just guessing. I'm just guessing.
You're probably right.
Keep raising your hand.
Yeah. So, well, if I had the super industrial size magic stethoscope wand, I think what I would do is eliminate poverty, right? Because there are health disparities, and a lot of this comes out in health outcomes are based in these disparities. And if you don't have access to healthcare, if you aren't able to be take the time off from work so that you can spend time with your baby and do your breastfeeding and do all these things, you are going to be behind with that. And I think that's why we see higher rates of infant mortality overall, as well as SUID, compared to European countries, because they take care of families after birth. So if I couldn't get rid of poverty, that's a pretty big ask. So I don't know if we can do that. But if there's something I think would be reasonable that we could do, I would go to the government, to our government, and say, you need to make a standard law of 6 months of paid time off with support, family support services to improve lactation, have access to health care, to be able to get a good night's sleep as best you can, and not have to worry about all these other things, about going back to work and not being able to breastfeed, having to worry about where your next meal is coming from, or whether you're going to get kicked out of your apartment because you can't pay the rent and you got to go back to work. So I would love to see us do that, just like other countries in Europe do. And I think that would have such a huge impact on overall health of our communities, and especially how well babies do in the first year of life.
Right. I mean, it is no mystery. We know that statistics, the highest rate of unsafe sleep deaths in SUID is 2 to 4 months. Well, that pretty much correlates with when mama finds herself going back to work and exhausted. And you make decisions that you wouldn't normally make when you were exhausted. So here, 6 months. Could you imagine? Well, let's see what we can do to get you that magic wand. It doesn't even sound like magic. It sounds totally reasonable. Okay, so thank you so much. This is it, you guys. We're wrapping up our first one. So Dr. Goodstein, or Mike, sorry, thank you. Given all those commitments, and you keep raising your hand, we genuinely appreciate the time you took to kick off our 25th anniversary monthly series. And thanks to all of you who joined us today. There are so many. I'm glad I didn't see how many there were. It was just Mike and me as far as I knew. And thank you for taking that time. And if you're watching the live recorded edition of this webinar, thank you for that. Our next monthly Safe Sleep Champion webinar is on Monday, March 27th at noon Eastern. Registration for that will open on Friday, March 3rd, so 3/3/23. Details are on our website, or you can follow us on social media. So now, what we promised, it's not a magic wand, but we are excited to debut Cribs for Kids' newest effort to change the culture around safe sleep. It's our first ever lullaby. It's called Just Baby, a Safe Sleep Lullaby. It was written by Amrita Soon in association with Songfinch, and it is dedicated to our much-missed colleague, Barb Clemens. You'll find Just Baby, a Safe Sleep Lullaby on our website and on Cribs for Kids YouTube channel. You'll find the song, the video for the song that you're about to see and hear, plus the music bed, and soon the Spanish edition. For each of these webinars, we want to give everybody who joins us an action item. So your action item after today is to share our new lullaby with family, friends, colleagues. If somebody hears you humming it when you're walking down the hallway or down the street, it's a sweet little earworm of a tune. So please share it. We're going to play it for you as we close out today's webinar. Again, I'm Devin George. Thank you to Dr. Goodstein. And Mike, we want to give you the honor of hitting play on Just Baby, a Safe Sleep Lullaby. Thanks, everybody.
Sleepy baby, sleeping safely in the little crib. Bassinet or play our naps, no pillows, blankets, no toys, just baby. Sleep safe, sleep safely, sleep safe, sleep safely. We share the room but not the bed, sleeping soundly on baby's back, all through the night or just for a nap, just baby. Sleepy baby, sleeping safely in a little crib. Bassinet or play yard naps, no pillows, blankets, no toys, just baby. Back to sleep and tummy to play. When baby's awake, make most of the day. And when it's time to fall asleep, through the night or just for a nap, just baby. Sleep safe, sleep safely, sleep safe, sleep safely. Sleepy baby, sleeping safely in a little crib. Bassinet or play yard naps, no pillows, blankets, no toys, just baby.